Hi guys, hello ladies and gentlemen, it's your boy Dr. In situ here. We're here to learn something interesting today. Recently, as you know, there's a whole news about the Omicron variant coming about, and this is an important time for us to go and read about vitamin D and the importance of vitamin D as an immunomodulator, so that we can stay healthy and stay safe. So today I want to look at this vitamin D supplementation article that was done in around 2017, yes, to prevent acute respiratory tract infections. I haven't read it, so this will be, it's just live. It's just me reading this article live. So let's go ahead. I found it in JSTOR articles. This is JSTOR articles. They have a lot of good research articles, so I found it in there, and I thought that'd be an interesting read because it is very relevant to the fact that we're discussing a respiratory tract disease or respiratory tract infections, how COVID-19 attacks your respiratory tract. So it is interesting. It is interesting to read this and how vitamin D supplementation does prevent acute respiratory tract infections. Although it's not for COVID-19 since in 2017, I just want to read the importance of vitamin D and how vitamin D is an immunomodulator. Me as a medical student, we have learned more about vitamin D in the absorption of calcium connection, but not much of a vitamin D as immunomodulation. That's if you go further in immunology studies, which I have found interesting. So we will also look at vitamin D as an immunomodulator. I think that's something we'll also be looking at. What does that even mean, that vitamin D is an immunomodulator? The sense of an immunomodulator is like multiple roles, you can say. Vitamin D doesn't have just one specific role, it has multiple roles. So let's go ahead and read vitamin D supplementation to prevent acute respiratory tract infections, systemic review and meta-analysis of individual participant data. Shout out to Mr. Adrian, David, DJ Griffins, Christopher Mauger, Dr. Murdoch, Dr. Neil, Dr. Stimson, Gita, Iona, Mizushura, Shemina, Carlos, and to all the ones that I could. And shout out to everybody who contributed to this article. All right, let's get to it. Okay, proceed. I want to make it big. So we can all see it right here, full screen. Perfect. So, ladies and gentlemen, again, it's Dr. In situ here, senior medical student. I have not read this research paper. It's been my first time reading this research paper with all of you guys. And the research paper is about vitamin D and its role in preventing acute respiratory tract infections. And it's not loading up. This is concerning. We're having trouble, so I'll download the PDF. Accept and download. Please try again shortly. Oh my god, ladies and gentlemen, what on earth? The article's not even working. That was disappointing. That. Okay, let's sign in. Guys, do we have access to BMJ? British Medical Journals. I'm using my UFT library card. Let's go, please sign in. Mesdames et messieurs, est-ce que vous marchez, s'il te plaît? Yeah, but can I read it, sir? No, sir, I'm looking. Oh, I see what happened. There's a possibility that I've been logged out from my account. So let's go back again. So this is out. Prevalence of vitamin D deficiency among ideal population of Isfahan, Iran city. Let's go to that if this doesn't come about. Let's see. Perfect. I think it has. So let me zoom in a bit big. Sorry for the delay, ladies and gentlemen, but I'm back on track right now. All right, so the abstract objective: to assess the overall effect of vitamin D supplementation on risk of acute respiratory tract infection and to identify factors modifying this effect. I designed systematic review and meta-analysis of individual participant data from randomized controlled trials. Data sources: Medline, Embase, the Cochrane Central Register of Controlled Trials, Web of Science, clinicaltrials.gov, the International Standard Randomized Controlled Trials number registry from inception December 2015. Eligibility criteria for study selection: randomized double-blind placebo-controlled trials of supplementation with vitamin D or vitamin D2 of any duration were eligible for inclusion if they had been approved by a research ethics committee and if data on incidence of acute respiratory tract infection were collected prospectively and pre-specifies as an efficacy outcome. Results: 25 eligible randomized clinical control trials. So 25 eligible randomized controlled trials, total 11,321 participants aged 0 to 95 years. 0 to 95 were identified. So you did 25 eligible randomized controlled trials, 25 eligible randomized, so they're completely random controlled trials that had about 11,321 participants. So that's a fairly decent pool. That's a big pool. Age 0 to 95 years, but identified IPD were obtained for 10,933 participants, all about 96%. Vitamin D supplementation reduced the risk of acute respiratory tract infections among all participants. Adjusted odds ratio to 0.88. 95% confidence interval, 0.81 to 0.096, and it does not cross 1. I'll take it, ladies and gentlemen. P for heterogeneity, less than 0.001. So you know it's significant. It is significant. Less than 0.005 is significance. In subgroup analysis, protective effects were seen in those receiving daily or weekly vitamin D without additional bolus doses. Adjusted odds ratio 0.81, 0.72 to 0.91, but not in those receiving one or more bolus doses. Wait a minute. In a subgroup analysis, protective effects were seen in those receiving daily or weekly vitamin D supplementation without additional bolus doses. So consistency with vitamin D is more important than taking a random chunk of vitamin D at a time. But still, having sufficient vitamin D is still important. So don't overload one day. Just be systematic with it. Bring it into your diet, into your habit. The vitamin D supplementation, let's see, but not in those receiving one or more bolus doses. But again, as a doctor, as a doctor in C2 medical students, I cannot prescribe, and I'm not prescribing. I'm just going by this article, how they're saying that weekly vitamin D without additional bolus doses were good, but not in those receiving one or more bolus doses, one or more. So now, among those receiving daily or weekly vitamin D, protective effects were stronger in those with baseline 25 hydroxy vitamin D levels, less than 25 nanomoles per liters. And just the odd ratio 0.3. Okay, so basically people receiving daily or weekly vitamin D effects were stronger. Those data is showing us vitamin D did not influence the proportion of participants experiencing at least one serious adverse event. Adjusted odds ratio. So taking vitamin D did not give you adverse events. Hey, that's what we want. We want to take a supplement that protects us or shows promise in the protection of acute respiratory tract infections. But we want to be careful that we're not overdosing with the supplementation, and knowing that the supplementation is not going to have side effects of the amount that we're taking it. So it's interesting, and that's ideally what we want. We want to use vitamin D in our own body, in our own immunity, a natural immunity. We want to strengthen our natural immunity against any disease per se, right? So vitamin D helps. The conclusion is that vitamin D supplementation was safe and it protected against acute respiratory tract infection overall. Patients who were very vitamin D deficient and those not receiving bolus doses experienced the most benefit. So people basically, so you gave vitamin D supplementation to individuals who are vitamin D deficient and who are as per se not receiving bolus doses. You give those individual vitamin D, what you find is that they have the most protective effects, and that's what this study did in 2017. And now we're in 2021, almost going to 2022. What it tells us right now is that if we can hold on to a vitamin D supplementation, that we should be, and that's what I say, people around 5 to 50 years old who do not have prior health conditions, we should be strengthening our immune system. Right? People who have compromised immune systems, or people who are involved with people who have compromised immune system, that's a different story. But not everyone, 5 to 50 years old who don't need, they should be looking more towards their vitamin D levels and how to strengthen their vitamin D. And it was interesting. I was looking at Dr. John Campbell, and he brought an Israeli doctor on board, and they were discussing on the importance of vitamin D and how the Israeli doctor was mentioning vitamin D has been good for treating his patients. And I want to watch that video too. Let's see if we can get that in here. I don't know if you should go further into this study. I think the conclusion is fair. I don't know if more people would want to go in depth reading the article, but we can just do a quick intro and see what we have right here. Let me just go down. Perfect. Center that up a little bit. Make it a little bit big, so you guys can read and see. Here it is. Let me just move this aside. So introduction. Acute respiratory tract infections are a major cause of global morbidity and mortality and are responsible for 10% of ambulatory and emergency department visits in the USA and an estimated 2.65 million deaths worldwide in 2013. Observational studies report consistent independent associations between low serum concentrations of 25-hydroxyvitamin D, the major circulating vitamin D metabolite, and susceptibility to acute respiratory tract infection. So observational studies are reporting that people who are deficient or have deficiency of vitamin D are more susceptible to acute respiratory tract infections. 25-hydroxyvitamin D supports induction to antimicrobial peptides in response to both viral and bacterial stimuli, suggesting a potential mechanism by which vitamin D inducible protection against respiratory pathogens might be mediated. Vitamin D metabolites, look, this is so interesting. I gotta repeat that. That needs a little bit more explanations. 25-hydroxyvitamin D, guys, listen to this. Supports induction of antimicrobial peptides in response to both viral and bacterial stimuli 5 to 7. We gotta check out that reference. I think let's check out that reference right now. That is exciting. I want to look at that reference because it said viral. You know, that's very realistic. COVID-19. We're right here. Let's get it. 2021, babies and ladies and gentlemen. Been in a minute till I need it, you see. I need that reference 5 to 6 right here. 5 to 7 was the reference by Hans Dottir S. Monic MM in the SL1 NL. What in respiratory epithelial cells convert inactive vitamin D to its active form? We know this from Yosemite step 1. Okay, what does this have to do with potential effects on host defense? Ooh, mon ami, parlez français un petit peu. Oh. This is interesting. This is, ladies and gentlemen, this is what I call interesting. We gotta look this up. Respiratory epithelial cells convert inactive vitamin D to its active form. We know that. You get your vitamin D from the sun, your epithelial cells converted into an active form. Understand. 25-hydroxyvitamin D. Let's keep on going. What do we got? Potential effects on host defense. How's vitamin D having a potential effect on host defense? So that's what's 5. Remember, is 5, 6, and 7. Let's do 6 is saying. It's by Spelming, L. Oliver, Normark. Immunomodulatory effects. That's what's like immunomodulatory effects of vitamin D on innate and adaptive immune responses to Streptococcus pneumoniae. So that's bacterial. I don't think we need to go to where it's that. Strep pneumo, guys, it's a very common bacteria that can cause respiratory tract infections in the hospital, and it's one of the most common bacteria for respiratory infections. That's what we learned in our USMLE's exams. Secondly, let's go look at number 7, Grayler CL Martino AR modulation of the immune response to. That's it, guys. Number 7, 2015. Man, this is this PDF I can't copy and paste. So, voyons. Let me see if I can tell Siri to Google this. Martino. Hey Siri, Google Martino modulation of the immune response to respiratory tract viruses by vitamin D. Oh, not on my phone. Siri, just Google that on my phone, guys. I was hoping the computer to pick on Siri. No, we'll have to. I'll have to write it down. So let's minimize this. This is interesting, guys. I need to look at those 2 references. This has gotten excited. Mon Dieu. Okay, let's do this. We are gonna solve this, my ladies and gentlemen. I think let's start with 7. I think that modulation of the immune response to respiratory viruses by vitamin D is something very specific we want to look for. Then I did like number 5, respiratory epithelial cells converting inactive vitamin D to its active form, but the potential effects on host defense. Boom! This is beautiful. Let's get it. I'm excited. I gotta just write it down, ladies and gentlemen. Exit full screen. Go on Google. Talk to me, Google. Respiratory epithelial cells convert inactive vitamin D to its active form, promote effects on host defense. 2015, I believe, is the article. I don't want to date it though. Let's see what happens. Pourquoi il y a des chinois ici, mes amis? Change the language, guys. Oh, how do you change the language? Sorry guys, I have to change my language into English. I don't know why there's Chinese right now. Come on, guys, man, language. Why is my laptop not typing? Perfect. Why are no, the language of the computer. Why is it in Chinese? Oh, I can't fix this right now, guys. Focus. Respiratory epithelials convert inactive vitamin induced active form. Potential effects on host defense. PubMD. This is it. Nina Lovan, Hunting Hake. Okay, this is perfect. This is what we were on the JSTOR article that we were talking about. Reference 527. Hans Dotir, Monique Lowen, vitamin D2 active. Perfect. Host defense mechanism. Let's get it. Abstract. The role of vitamin D in innate immunity is increasingly recognized. Recent work has is increasingly recognized, and yet they never told us. It's increasingly recognized, and we were not told, and we had to take forced into taking a vaccine that we had no intention of taking, some of us. Or we had intention of taking and not realize the importance of vitamin D. So we did ourselves danger and do dangers to the people around us and the loved one around us. We allowed a corporate capitalist to come in. Sure, even if they had the right intentions, but we're being hidden information, guys. If this was the best fighter for it, why did we not have this in our arsenal? Anyways, let's read. The role of vitamin D in innate immunity is increasingly recognized. Recent work has identified a number of tissues that express the enzyme 1-alpha hydroxylase, very important enzyme, and are able to activate vitamin D. This locally produced vitamin D is believed to have important immunomodulator effects. That's the one we were talking about, immunomodulator, meaning it modulates our immune system. It can modulate. Yes, it can modulate, it can control, it can change our immune system. That's amazing. Vitamin D. In this paper, we show that primary lung epithelial cells express a high baseline levels of acting 1-alpha hydroxylase, which is amazing because where is it going? Where is SARS-CoV-2 spike protein going? It's attaching to the ACE2 receptors on type 2 pneumocytes. Exactly what we want. What we want here is to see that the respiratory primary lung epithelial cells express a high baseline levels of activating 1-alpha hydroxylase that's going to convert the vitamin D, and low levels of inactivating 25-hydroxylase, which is interesting and good. The result of this enzyme expression is that every epithelial cells constitutively convert inactive 25-hydroxyvitamin D3 to the active 125-hydroxyvitamin D3. Active form 125 converted by 1-alpha hydroxylase. Active vitamin D that is generated by lung epithelium leads to increased expression of vitamin D regulated genes with important innate immune function. These include the catalycidin antimicrobial peptide gene and the toll-like co-receptor CD14. Double-stranded RNA increases the expression of 1-alpha hydroxylase. Double-stranded RNA. And what do we know about coronavirus? Positive send single-stranded RNA virus. Wait, I need to confirm that, even though your boy knows, but I confirm single-stranded RNA corona positive. Talk to me, boys. Talk to me. Vicky. SARS-CoV-2 is a positive single-stranded RNA virus. Thank you, alhamdulillah. I like to be right from time to time. Baby, now tell me why that you love me. You're back now for memories to see. How do we go here? Guys, I was reading PubMD. Yes, right here. So double-stranded RNA increases the expression of 1-alpha hydroxylase, augments the production of active vitamin D, and synthesizes and synergizes with vitamin D to increase expression of cathelicidin. In contrast to induction to the antimicrobial peptide, vitamin D attenuates double-stranded RNA-induced expression of the natural factor kappa B-driven gene interleukin 8. It's interleukin 8, ladies and gentlemen. Woo! We conclude that primary epithelial cells generate active vitamin D, which then influences the expression of vitamin D-driven genes that play a major role in host defense. Right here. They're concluding that the primary epithelial cells generate active vitamin D, which then influences the expression of vitamin D-driven genes that play a major role. Vitamin D genes are getting activated by the active vitamin D that are playing an important integral role in the host defense mechanism. Beautiful, subhanallah. Okay, what else do we have? Hallelujah. Hallelujah. Furthermore, the presence of vitamin D alters induction of antimicrobial peptides. And that's exactly. The presence of vitamin D alters induction of antimicrobial peptides and inflammatory cytokines. What are we talking about in COVID when patients are getting a cytokine storm in response to viruses? This is why there's a study by Yale and they're re-promoting boosters. And I'm going to do a normal... calm down. I'm going to do a very critical analysis on that in the Yale paper, and that's going to come, guys. We're going to do that because they're promoting boosters, and I'm not for that promotion unless you have prior health conditions. If you're not in that group, I'm not. I'm talking about let's strengthen our immune system naturally with the natural positive health. Vitamin D, vitamin K2. Make sure you keep on having those. Okay, we conclude that primary epithelial cells generate active vitamin D. We said that. Furthermore, the presence of vitamin D alters antimicrobial peptide. Yes, right here. Furthermore, the presence of vitamin D alters the induction of antimicrobial peptides and inflammatory cytokines in response to, read that, ladies and gentlemen, that says response to viruses. This was done in... Wait, I thought it was 2015. It's not even 2015. It's 2008. We have known about the role of vitamin D and its role in a potential host defense against respiratory tract viruses since the year 2008. And we allowed a pandemic like... Unbelievable. It just makes me... It boils me inside. I'm so cheesed right now. I'm honestly really disappointed. These observations suggest a novel mechanism by which a local conversion of inactive to active vitamin D alters immune function in the lung. They're going to show us. Okay, so mRNA expression relative to HPRT. CYP27B1 HTBE cells, CYP24 alpha A1. Wait, so 0.02, so relative to, what is HPRT standing for, guys? Give me my references, mes amis. Donnez-moi un peu de référence, hein? Okay, wait, I gotta read this page and then we'll look at it. What's happening here? So 125 hydroxyvitamin 3 D3, that's active form as it's increasing. 25 D3. No HTBE cells. Oh, no cells as it increases. Primary respiratory epithelial cells are primed to convert inactive vitamin D to its active form. We know that using 1-alpha hydroxylase. Cells were cultured in media for 24 hours, harvested, and mRNA measured using quantitative real-time PCR at baseline. Man, this is interesting. They had known, they were harvesting. They were using mRNA technology, man. They had it in their baseline. At baseline, in HTBE cells express relatively high levels of the activating 1-alpha hydroxylase. Activating 1-alpha hydroxylase CYP27B1. Oh, CYP27B1 is alpha-1 hydroxylase. Oh my god, HTBE cells have it so much activated mRNA expression. Look at that. And 2,420. Oh, those were the 1-alpha hydroxylase. That was 24 hydroxylase alpha-1. mRNA expression relative to HPRT. A549 cells, HTB cells. A459 cells don't count. A549 cells don't count, but HTB cells do. Okay, so let's go again. Got it. They were not as opposite. Graph reflects mean relative expression of hydroxylases compared to HPRT and SEM of 3 or more independent experiments. HTBE cells were treated with increasing dose of inactive vitamin D. Inactive vitamin D was measured in supernatants 24 hours later. HTBE cells convert the inactive 25D3 to the active one 25D3. Oh, those are HTB cells, respiratory epithelial cells that are the good ones that are okay. When inactive vitamin D is added to media without cells, no active vitamin D is ejected. Graph reflects mean 125 hydroxy vitamin D3 levels. Right here, graph reflects mean 125 hydroxy D3 levels and SEM of 3 or more independent experiments. Students t-test p less than 0.01. How am I to interpret that? HTBE cells were cultured in the irregular. This graph. Let's look at this. So CYP24A1, these are 1-alpha 24 hydroxylase. We're not looking for that one. 25D3 active form. Change 24 beta actin. No. Let's look at the CD14 mRNA. CD14 protein. Catalysated mRNA. We're cutting the graphs. Viral RNA increases both the expression of 1-alpha hydroxylase and conversion of 25D3 to 125D3 and synergized vitamin D. What? Viral RNA increased both expression of 1-alpha hydroxylase and conversion of 25D3 to 125D3 and synergized with vitamin D to induce the antimicrobial gene catalysidin. Antimicrobial gene catalysidin reference ASAP right now, ladies and gentlemen. Antimicrobial, I just need that refresh. Gene catalysidin. Oh, ça marche pas, mon Dieu. Allow. Antimicrobial. It's listening in Chinese. I need to do this. This is killing me right now. Antimicrobial gene catalysidin. I don't want to go on a tangent, but catalysidin serves critical mammalian innate immune response defense against invasive bacterial infection. Peptides are classified as antimicrobial peptides. The AMPB also include catalysin. Oh, defensins. Now I remember this. Okay, now I remember it. Ladies and gentlemen, let's go back to reading about that, which is interesting because they're saying that viruses have the ability to activate 1-alpha hydroxylase to convert 25 hydroxy vitamin D to 125 hydroxy vitamin D3, which is the active form. So viruses are actually helping you convert if you have enough vitamin D in your body system. This is gonna blow my mind. You're such an I can't believe this is happening right now. This is like lying to my face. To induce antimicrobial gene catalysidin, HTBE cells were treated with the synthetic double-stranded RNA poly 20 microgram per liter with or without 25D3 for 24 hours, and cells harvested for RNA. mRNA was measured using quantitative real-time PCR. Holy 125D3 was measured in supernatants. Poly-C2 treated cells have significantly higher expression of 1-alpha hydroxylase than control cells and convert more 25 hydroxy D3 to 125 hydroxy D3 active on poly-C alone does not induce catalysated mRNA unless vitamin D is present, and then the two synergize. This just, you guys don't understand what just happened. You guys don't understand what just happened. They have literally said that. I need a minute. Sorry, I had to drink water, guys. I just needed to drink. Wow, that just it just got so hot in here, like it's not even funny now. Okay. They're basically saying that they knew about viral RNA, viruses, and RNA association, and how viruses and RNAs, how viral RNAs are able to activate 1-alpha hydroxylase, which is known to convert the inactive vitamin D3 into active 1,25 hydroxy vitamin D3, which has host defense response. But it will only happen if there is enough vitamin D present, or there is vitamin D present. Then they will synergize. So you need vitamin D. So vitamin D attenuates the poly-IC induced induction of the interleukin 8 mRNA. HCP cells were infected with respiratory syncytial viruses for 24 hours in the presence or absence of 25 hydroxy vitamin D3 and harvested for RNA. mRNA was measured using quantitative real-time PCR. 125 hydroxy vitamin D3 was measured in supernatants, as with okay, we got it. mRNA is significantly higher in respiratory syncytial viruses treated cells than in control cells, and respiratory syncytial viruses infected cells are more efficient in converting 25 D3 to 125 D3. Amazing. Different from RSV alone does not induce catholicity, but like poly vitamin D and virus synergize to induce catholicity. Okay, I'm not 100% on that. Graphs reflect mean and SEM or 4 more independent experiments when comparing two groups of paired students. T-test was for all comparisons, repeated measures. ANOVA, this epidemiology again with Bonferroni's test for multiple comparisons apply difference control. P001 differences from control is non-significant. PVSN less than, but here is significant, less than 0.05. Interesting. Okay, guys, this is shocking news. Now, yeah, I just don't know what to do. I think I want to read this, though. I want to read about the prevalence of vitamin D deficiency among adult population of Isfahan city in Iran. And the reason I want to do this is different. It's done by different doctors. It's done by a different country in different world. It's Iran, ladies and gentlemen, and as we know, the US and Iran are not or they claim not to be friends or whatever relationship these guys have. Everybody's corporate at the end of the day. It's all about money to everybody. People don't care about normal people, unfortunately, and this is sad. This is the sad reality of our world. We live in a very capitalistic world, and we've seen it with this virus. We've seen the hunger for just making money, and the disregard for the human life and human body. Honestly, it's a disregard for the human body. If as doctor we have this thing called maleficence, and I want you to read this definitions with me about maleficence, please. Let me just type it here. Wow, there is some serious problem going on. Maleficence. This right here. What is a principle of maleficence? The principle of non-maleficence holds that there is an obligation not to inflict harm on others. It is closely associated with the maximum primum non nocere. First, do no harm. So, first, do no harm. The four basic ethical principles that apply to forensic activities are respect for autonomy, beneficence, non-maleficence, and justice. Oh, that's for forensic activities. Interesting. But we are looking for, well, it's very similar. I mean, you have respect for autonomy, beneficence, non-maleficence, justice. Interesting. We got to go. Medical. Because we want to see the non-maleficence. First, do no harm to your patient. Okay, Pepipedia. Non-maleficence. Close. Non-maleficence, a term in medical ethics that derives from the ancient maximum primum non nocere, which translated from the Latin means first do no harm. maximum primum non nocere. The principle of non-maleficence directs physicians to do no harm to patients. Physicians must refrain from providing ineffective treatments or acting with malice towards patients. This principle, however, offers little useful guidance to physicians since many beneficial therapies also have serious risks. The pertinent ethical issue is whether the benefits outweighs the burden, and that's what they've been trying to say. They say, oh guys, would you want to get, it's better not to get COVID, so get vaccinated, even though you might get COVID, even though you're vaccinated, but that's caused through a breakthrough infection. Regardless, you won't be as severe affected as you were affected with COVID in the first place. But if you strengthen your immune system and you fix your immune system and increase your vitamin D intake, because we know now it's an immunomodulator, you can do good. And you can be protected if you don't have prior health conditions and you're naturally healthy and strong. And this is why individuals like me, we stayed away from these type of things, because I just want to focus on my natural immunity and my supplementation or my supplements and having a good diet and being healthy and being active, than rather falling into an agenda. So I don't want to do that. I'm sorry, because I would like to practice non-maleficence, and I would not want to do that for other individuals also. So one of the most common ethical dilemmas arise in the balancing of beneficence and non-maleficence. This balance is the one between the benefits and risk of treatment and plays a role in nearly every medical decision, such as whether to order a particular test, medication, procedure, operation, or treatment. By providing informed consent, physicians give patients the information necessary to understand the scope and nature of the potential risks and benefits in order to make a decision. Do you think physicians gave individuals who came out with myocarditis that, hey, you could get myocarditis? Ultimately, it is the patient who assigns weight to the risks and benefits. Nonetheless, the potential benefits of any intervention must outweigh the risk in order for the action to be ethical. And that's what they've been using against us, ladies and gentlemen. But I just wanted to show you, so I do not wish to intend to do harm on any individual. So I won't subscribe something that I'm not myself taking. So I'm sorry, Pfizer, and I'm sorry, Moderna. So I just want to go ahead and read this article. And this is interesting because, as I mentioned, this is from a different country, a different people than our northern city in Iran. Beautiful Syria. I hope I go, inshallah. Make dua, yallah, immuno Isfahan. Determination of vitamin D status in different age groups in a community and in different climates of a country is necessary and is important implication for general health. The study was conducted to determine the prevalence of vitamin D deficiency among the adult population of Isfahan, a centrally located city in Iran. In this cross-sectional study, 1,111 healthy people, 243 men and 868 women aged 41.4, mean 14 years old and range 20 to 80 years old years, who attended a single consultation outpatient clinic. A single outpatient clinic were selected serum 25 hydroxyvitamin D, PTH, parathyroid hormone, calcium, and phosphorus concentrations were measured. Mild, moderate, and severe vitamin deficiencies were defined as 25 hydroxyvitamin D levels of 20 to 30 nanograms per milliliters, 10 to 20 nanograms per milliliters, and less than 10 nanograms per milliliter, respectively. The median range concentration of 25 hydroxyvitamin D were 21. So, that's pretty low. That's not bad. What's normal? 21, 4.0. in males, and 18, 1.5 to 117 nanogram in females. Significance 0.05. So it is significance. The only is, what is your natural vitamin D range, guys? They'll tell us. So the prevalence of mild, moderate, and severe vitamin D. I think let's read the article and then we'll come back here. Wow, this is a lot of reading, ladies and gentlemen. I think this needs to be into a separate video in itself. I think I'm going to read this tomorrow. Well, later on. I'm just going to read this in a few minutes, guys. I'll have to come back to this. But again, let's start this again. Let's continue reading more about vitamin D. Please search some interesting vitamin D articles that you guys want me to read. Search the importance of natural immunity and vitamin D as an immunomodulator and how it can be an effective tool against respiratory viruses. So please, if you find something, do pass it along. I'd love to read it, and we can maybe read it together here in live. So thank you very much for tuning in. Dr. In situ here. Peace. Adios, amigos.